Hi, I'm Dr. Ken Sharlin. I'd like to talk with you a little bit today about what we call our 5-pillar system at Sharlin Health and Neurology. This is the basic approach that we take with everyone that comes in that's interested not only in working with me as a neurologist, but as a functional medicine doctor. It's really key that you understand this because ultimately you're coming for help, you're coming for an outcome that you want. And in order for me to help you, it's important to understand a little bit about what we do and how we do it. Now, the first pillar is called identify. We're going to have some additional videos on the other pillars of investigate, integrate, restore, and regenerate. But this one is on identify. So what does identify mean? Well, people come and see me for some different reasons. Sometimes they already have a diagnosis, but a lot of times they don't. And even if they have the diagnosis, I'm going to make sure that the diagnosis is correct. I found that about 20% of the time, the diagnosis that a person has when they come to see me is not even correct. So it's very important to understand what is going on. If you don't have a diagnosis, meaning you have maybe brain fog, weakness, numbness, or alteration in sensation, pain, dizziness, and so forth, gait or balance changes, movement changes, all of those need to be evaluated. Ultimately, what we're going to do is sit down, take a very detailed medical history, not the 5-minute, 10-minute experience you're used to at the typical doctor's office. A solid history in my clinic could take, 20, 30 minutes, and that's really listening to you, having you tell me your story. We're then going to go through a detailed physical exam. Now, this is a neurological exam, so it's more than just listening to your heart, although that's obviously important. But we're going to go through a detailed neurological exam. And the reason is because even though most of the diagnosis is based on a detailed medical history, the physical examination is very important as well to get clues. And then ultimately, we do something called localization. Now, that's my job. It happens sort of invisibly, but ultimately what that means is that the nervous system is a vast geography. That's everything from your brain, your brainstem, your spinal cord, the nerve roots coming off your spinal cord, the peripheral nerves, what's called the neuromuscular junction where the nerves and the muscles communicate, and the muscles themselves. That's a vast geography. So for example, if you have weakness, just as an example, you could have weakness because you have a problem in the brain. You could have weakness because you have a problem in the spinal cord. You could have weakness because of a peripheral nerve problem. You could have weakness because of a muscle problem. And it's important to understand that before we start talking about the cause of your weakness, we really have to understand where that comes from. That's the localization. That gives me then an idea of where within the nervous system the problem is coming from and what types of conditions can cause that problem based on the localization. I haven't even talked about testing at this point. So too often you come to the doctor and they just want to shotgun you with a bunch of tests. That's not how it should be done. It starts with the history. It goes through the exam. We then do the localization. And then we start thinking about a list of potential explanations. In the language of medicine, this is called a differential diagnosis. Finally, with a list of reasonable potential explanations in mind, that's when we want to start thinking about what tests are appropriate. Let me reassure you that here at Sharlin Health and Neurology, I'm going to be ordering cutting-edge tests, some of which you've never seen done at other neurology clinics. That might be spinal fluid testing for Alzheimer's disease. It might be genetic testing. It might be automated 3D volumetric analysis of your brain using MRI, but going a level above MRI. Ultimately, what we want to do is take the information from that list of possible explanations, narrow things down, and dial it in with the appropriate diagnostic tests until we understand exactly what is the diagnosis. Now, I know most of you who are watching this video are especially interested in addressing the root causes, and that comes in with the investigate and integrate pillars. But it's still very important that we start with that disease-centered approach so we understand what is the problem that is affecting you so that we can then go on and explore the factors that are contributing to the problem in the first place. Or as we say at Sharlin Health and Neurology, what has put you on the trajectory and what is keeping you on the trajectory. Because ultimately, with that information in hand, we can help you change the trajectory of your illness, whether that's Alzheimer's disease, Parkinson's, multiple sclerosis, ALS, epilepsy, migraine, and so forth. So the first thing that you need to do, if you're interested in this type of approach, is go to our website at functionalmedicine.doctor, go to the page where you can fill out a form requesting a free 15-minute consultation, speak with my functional medicine coordinator, and find out how we can serve you and ultimately help you solve the problem that you haven't been able to solve with other practitioners. I'd love to meet with you and look forward to hearing from you soon.